Hi, Dr. Lynn.
Hi.
Hi. So I was going to make an introduction to everybody. People are joining in. So I was just saying this weekend is all about PMS versus PMDD. And I had already posted an announcement giving an introduction a little bit about PMS versus PMDD. And today I have the pleasure of having Dr. Lynn. She is a licensed naturopathic doctor. She practices in Ontario, Canada, and she has a clinical focus and a very strong background in women's health, specifically in hormones and period problems and PMS. So it's really great to have you here. And if you want to say a few words about yourself.
Yeah, thanks for having me and thanks for the introduction. So, yes, like my clinical background and focus is mostly on women's health. And so, most of the time, I see women coming in and talking about some of the hormonal symptoms that they have, which includes PMS. And we're often having to differentiate between, like, is it PMS, is it PMDD, or is it premenstrual exacerbation of another condition that they might have
Yeah.
beforehand? So,
Mhm.
yeah, like, this is definitely a topic that I'm excited to talk about.
Okay, so we will actually get started with the most fundamental question, which is what is the difference between PMS and PMDD, and what are the differences in the symptoms?
Sure. So when it comes to symptoms, they're actually very similar, like in terms of like the actual symptoms, but the differentiating factor is how severe is it? So someone who has PMS, most of the time, it's just more of an annoyance. It's like, my boobs are hurting and, I kind of feel moody, but it doesn't get in the way of relationships or work or anything like that. Versus someone who has PMDD, it's more severe. So a lot of women have to take time off of work, or they have more conflicts in relationships during that time. Their low mood actually leads to suicidal like thoughts and ideation sometimes too. So it's just the severity of it is a distinguishing factor here.
Okay, so what exactly causes PMS and PMDD?
Yeah, so this is actually a really complex question because I don't think it's fully understood yet. The main thing that they're looking into is they're finding that when it comes to hormones, the hormonal levels on blood work is actually normal. There's no changes in hormones in that sense, but it's more the sensitivity that these women feel or these
Uh-huh.
menstruators feel to their fluctuating hormones. And so someone who doesn't really experience PMS, they have completely like natural fluctuations in their hormones. And someone who is experiencing PMS or PMDD, they have the same shift, but that shift actually causes them to have more symptoms in themselves.
Hmm.
And so they're sensitive to the shift, kind of like someone who is sensitive to like temperature changes. They go outside, they're too hot. They go back in, they're too cold in the air conditioner. Versus another person may not feel that. It's the same thing with hormones. Some people are just more sensitive to the natural fluctuations.
Hmm. So is it something which is like hereditary?
Yeah, so again, when looking at the etiology, there seems to be a few different things that they're looking into, and the stats are super wide when it comes to the answer to this. It's somewhere between 30 to 80% of people seem to have a genetic predisposition to it. So again, it's such a wide range that we don't quite know yet what the answer is, but there seems to be a genetic influence to it. Yes.
Okay, and can stress affect it?
Yeah, so what we know about stress is that, the stress response involves cortisol spikes and cortisol helping us deal with stressors. But what we do know about cortisol is that it will impact our sex hormones and our periods. And so it definitely has the impact on PMS. People who have more stress in their lives or are going through a really stressful period of time or have like a traumatic experience happening too are more likely to experience PMS and potentially even PMDD.
Hmm. Okay, so how long do the symptoms of PMS and PMDD last?
Yeah, so typically speaking, PMS in like the traditional description of it is usually just a few days before you get your period. And so it's those like 5 to 7 days prior to getting your period, so the week before that. And then when it comes to PMDD, sometimes it's a little bit longer. So it can reach more like the 10, 12, or 14 days. So
Hmm.
people who experience PMDD or have a diagnosis of that can be extended into their whole luteal phase that they feel those symptoms.
Okay. And one major symptom actually of PMDD, which you also mentioned, is the suicidal thoughts. So why do you think like people have that extreme of thoughts in PMDD?
For sure. So it comes down to, again, one of the causes of a PMDD is the naturally fluctuation in the hormones can actually change the response of neurotransmitters in our brain. What we do know about estrogen is that it does influence serotonin and our serotonin receptors in our brain. And so during the luteal phase, there's a bit of a spike in estrogen, and then there's a crash in estrogen. And so that spike and crash leads to a change in serotonin. And so that can definitely increase a risk of suicidal ideation in women who are menstruators who are more prone.
Okay, I think there was a connection problem, but can you say something again? Just the last line.
Sure. So I said, so what happens with the serotonin receptors is that, like, with a shift in estrogen and the serotonin in our brain really ends up leading to those shifts in mood, especially in women who are more prone to mood changes.
Okay. So, when I asked this question, I had put up a question box in my stories, and not many people were actually aware of PMDD. Most of the women are aware of PMS, but not of PMDD. So, does it go by some other name as well?
So PMDD is short form for premenstrual dysphoric disorder. But I agree with you. Most women don't even know that that exists, or most traders don't know that that really exists. And I think part of it is because we don't really talk about it, right? Like, even with PMS, we're usually just taught, like, it's normal, like, you're just like PMSing, no big deal. And it's like, well, actually, if it comes in the way of your life and comes in the way of relationships or how you're able to have really good quality of life that time of your cycle, it is a big deal. And it should be something that should be explored for sure.
So another question that I got on my question box was about, can PMS and PMDD be characteristic of estrogen dominance?
So yes and no. So I would say if you Google PMS or PMDD, obviously estrogen dominance sorry, I thought there was a connection issue. So when it comes to PMS and PMDD, there could definitely be a bit of estrogen dominance, and that's what Google will tell you. But when it comes down to it, whenever we test people's hormones, they all come back the same, whether they have symptoms of it or not. And so it seems to be that fluctuation in hormones that some women are sensitive to, which is sometimes very defeating because you get your blood work results back and you're told everything's normal. And so it makes some people feel like, well, I must just be making it up and it must not be true. And it's like, no, it's very much true. It's just someone is more sensitive to the shift versus someone else may not be.
So you're mentioning about the blood work and everything. So are there any specific kind of test or blood work for, diagnosing PMS and PMDD?
Yeah, so when it comes to diagnosing, that's what's so tough, is that there's no specific blood work needed to make the diagnosis. In fact, we don't really find it super useful. So what I tend to use blood work for is to rule out other conditions that might be causing symptoms similar to PMS, because there are certain conditions that might mimic PMS. Or there's also what I talked about earlier, the premenstrual exacerbation of another condition, because we know that other medical conditions can actually worsen during that time of the cycle. And so we want to make sure that it's not that, so that we can fully know for sure if it's PMS or PMDD. But it comes down to asking people to track their cycles and their symptoms there's a lot of different scales that you can use to track that. And then from there, looking at 2 to 3 months worth of data and seeing how they're feeling. But I do tend to run hormones, thyroid, prolactin, just to make sure that nothing's going on and nothing could be causing those symptoms.
Okay. So I think there's a question. Let me open the question box, which is it's the same thing. How do we diagnose PMS and PMDD? So in terms of, like you already mentioned, so these are the tools which you used for diagnosing PMS and PM. So my question mostly is, if somebody comes to you, so what are those situations in which somebody would approach you, and how would you go about diagnosing PMS or PMDD?
Yeah, so I feel like that should be screened in most menstruators, because at the end of the day, again, we are just taught that something is normal when it may not be. So what I tend to do is I just ask about, do you experience any of those symptoms? And if they say yes, then I give them a tracker for the next 2 to 3 cycles, so that way they can track and relay back to me actually with data, like how they felt the last 3 cycles, so that we can know for sure, like how severe is it, what symptoms they're having, and how we can better support them. And if it's only happening maybe in the luteal phase or not, because sometimes it's hard to remember, like, do I only get bloated in that time of the cycle, or is it all month long? Right. And so, yeah, tracking and having a really skilled practitioner to differentiate between normal PMS versus PMDD versus a more severe type of PMS, or like premenstrual exacerbation of another condition.
So another question which I actually got was, what was the right time for people to seek help? So what are the red flags? Because
Yeah.
usually, as you said, like people just ignore most of the symptoms. Yeah.
For sure. I would say the best thing, or when to seek help, is when it's really getting in the way of certain things. So if, again, you're just like slightly annoyed by your symptoms and it's not really getting in the way, you don't really think about it all day long, then it might just be a normal like symptom that you're experiencing. But if it's something that gets in the way, and you're not able to function well in your daily life or at work, and it's getting in the way of relationships too with people around you, because we know that conflict can come up a lot with like mood changes and irritability as part of PMS or PMDD, that's when someone should really talk to their doctor or healthcare practitioner about options.
So coming down to treatment options, what are the treatment options for PMS? Let's start with PMS first.
Yeah. So when it comes to PMS, I'm assuming you're asking for like pharmacological treatments.
Yeah.
But yeah, so when it comes to that, like the evidence is pretty strong, like towards more like nutritional changes. And so what's the interesting with that is that they've noticed that people who have very extreme diets have higher rates of PMS. And so that means anything that's like active or extreme in any way. And so we really focus on like a whole foods approach and making sure that women are eating, or menstruators are eating, really healthy food, enough calories, and eating consistently throughout the day, and also enough carbs, because we know that if people cut down carbs too much, that could also lead to serotonin changes in their brain. And so we want to make sure that they're having enough carbs, enough fiber, enough nutrition. We also know is that exercise is fantastic too. But when it comes to supplements, I'm assuming you were also asking about supplements. There's pretty good evidence for Vitax, especially for like mood changes, bloating, and irritability. And then some pretty strong evidence to like most of the studies are looking at calcium carbonate specifically, and they've noticed that it helps for both somatic but also behavioral symptoms that come with PMS or PMDD.
Okay. Yeah. Let me see. So in terms of like PMDD,
oh, sorry, you cut off.
Yeah. So yeah. So in terms of PMDD, are there any specific, non-pharmacological options that you use for treatment?
Yeah, when it comes to PMDD, it's definitely tricky because I'm very in my approach, and so I like to look at the evidence behind it. And these actually don't look specifically at PMDD, even if the title of the study says both PMS and PMDD. When you have data, they only looked at women who had PMS specifically, but they extrapolate that data to say like it potentially will be beneficial in people with PMDD. And it's essentially the same therapies, because there doesn't seem to be research done on women with only PMDD. It seems to be they research women with PMS, and they say that it's likely going to be beneficial for those with PMS as well.
So
so yeah, like if you wanted me to repeat all the options, I would say like the Chase Tree Vitax, like calcium. We know omega-3, zinc have some evidence for it too. Yeah.
So, I mean, in terms of like women who actually approach you, are these the women who are approaching you for the first time directly for the treatment, or are these the women who have also tried other treatments, pharmacological treatments, and then they basically approach you? So, yeah, if you can, highlight that.
For sure. So what I find, can you still hear me okay, or is it too loud?
Yeah, I can hear you. It's no, it's okay. Yeah.
Okay, I can move if it gets too loud, so just let me know. What I was going to say is women who approach me, or menstruators who approach me with these issues, what ends up happening is that I'm usually the first to have that conversation with them. Like, is this PMS or is this PMDD? And then from there, I end up talking to them about like what the options are. What we do know about PMDD is that the first line is usually an SSRI. And it doesn't mean the SSRI or an antidepressant all month long. There is research to show that if the woman only takes it during those times of the cycle where she feels mood changes, it's actually beneficial. Usually we have a conversation about like, hey, should you talk to your medical doctor or psychologist or psychiatrist about like potentially starting a therapy like that. And then we can also like try and ask too, depending on where they're at. Obviously, if someone has suicidal ideation, that's more severe and they do require something a little bit more when it comes to that. But yeah, if it's not as severe, we definitely have some space to try naturals first.
So is there a scope like, people actually go in hand with the cognitive behavioral therapy, for example, and along with like, the other kind of treatments?
Yeah, definitely. Because I find like CBT or any like counseling can also help deal with symptoms. So it's obviously not going to change how your brain functions with like hormonal fluctuations, but it's going to be able to help support a woman so that they have better strategies around how they can deal with this extreme change in their mood that time of the cycle.
So now I'm actually also going to go into a little bit about the condition, about the questions that I got in my DMs. So first one is, how does PMS affect other medical conditions? For example, your blood pressure, weight, hair fall, and appetite.
Yeah, so when it comes to other medical conditions, there is, like I mentioned, the premenstrual exacerbation, meaning that medical conditions that you have prior to the PMS time of your cycle could actually worsen as part of the hormonal fluctuation. And that's something that we see commonly with mental health conditions like anxiety, depression. But then we also see that like eating disorders, especially binge eating disorders, because cravings go up and like there's appetite changes as well. And with insomnia, right? Like insomnia can worsen that time of the cycle for someone who has the entire cycle. So there is definitely something there. And that's what's tricky about making the diagnosis sometimes is, are the symptoms only caused by the fact that you have a medical condition and now with the fluctuations in hormones, is that what's worsening, or is it true PMS or true PMDD?
And another question that I got was, do breastfeeding mothers, they also experience PMS even if, they haven't got their periods back?
Yeah, so the true definition is ovulation needs to happen at that time of the cycle, like mid-cycle, for true PMS to happen. Doesn't mean that they can't experience symptoms. There might still be fluctuations in their hormones. So they might experience something that's like PMS, but cannot be categorized like PMS. So yes and no. It wouldn't be true PMS, but it would definitely be like true symptoms associated with hormonal fluctuations that appear to be PMS.
Okay. And then, people have been asking me, so is the period cravings real, which you also mentioned that it is, kind of people feel that. And then also about, the kind of
period cravings real. And what I usually tend to tell my patients is that there is something behind that. So the more like we crave sweets or sugar, like we shouldn't be eating candy or like chocolate right before a period, but definitely if we lean more into complex carbs, like a little bit more, a little bit more rice and like whole grains, that definitely does seem to have an impact on our PMS symptoms in a positive way. And so like leaning into those cravings a little bit without overdoing, definitely beneficial.
Yeah. So are there any foods that you would say that, we shouldn't eat at all during that time?
Yeah, so alcohol intake seems to be correlated with severity of PMS for sure. And so moderate alcohol during that time of the cycle does increase by 45%. And then heavy alcohol by about 80%. So I usually recommend like no alcohol during that time of the cycle, if possible. Obviously, like once in a while, like there's an event or something. And then what we do know also about steak is that the higher salt consumption during that time of the cycle does also increase PMS symptoms. And so I usually recommend like lower salt, higher vegetables to compensate with the potassium levels in vegetables. So we want more potassium to help support women and their hormones.
Okay. And multivitamins that can be taken was one of the questions you already mentioned, that part before. Then
Yeah.
another was how to reduce acne during PMS.
Yeah, so acne is a tricky one for sure, because bad acne is that for a lot of women who have it, or a lot of people who have it right before their periods, there is a bit of a worsening that happens. And I would suggest that, like, usually we look at, is it because they're increasing their like refined sugar intake, like what's happening that time of that could be causing more acne. And it's usually linked to like a mixture of both hormones but also behavioral changes that
Mm-hmm.
happen with the symptoms that come on. And so we do a little bit of like supplemental support, whether it's like something like zinc or blood sugar balancing supplements to help with the
Mm-hmm.
acne, but also helping with the other symptoms is just as important. So like the calcium, the Vitex, other things that we
Mm-hmm.
mentioned before.
Okay. And then it was how to deal with stress and anxiety, migraine, headaches, and manage energy levels and bloating during PMS.
Yeah. So calcium, I would say, has the strongest evidence for all of that. I think it hits most of them in terms of like benefit, is what the studies have found, like anywhere between that 600, no, I think, sorry, it's 800 to 1200 milligrams per day of calcium
Mm-hmm.
carbonate. The research is pretty strong, saying a lot of those symptoms, especially like both the physical as well as the mental behavioral changes as part of PMS. So that would be
Mm-hmm.
one way of managing it. Another way would be like eating as healthful during that time of the cycle
Mm-hmm.
and not
Yeah.
shifting your diet much, because we all know that we can overeat that time of the cycle, or we might change what we're eating and consuming more refined sugars. So just healthy whole foods diet, that means like regular 3 meals per day, potentially snacks, and making sure that we're restricting what we're eating.
Mm-hmm. So I just want to make sure that when we are talking about the calcium and other kind of things, so does like a regular multivitamin with that much amount of calcium and other things, can it be helpful, or is it like specifically you have to have some other kind of multivitamins?
Yeah, so multivitamins, I would say that because they're trying to put everything in one capsule, it doesn't have the right amount of calcium in it. Because again, the research was looking specifically at like 800 to 1200 milligrams. So unless you're able to reach that in a multivitamin, it's hard to know if it's going to be beneficial or not. There still does contain calcium in the multivitamin, just maybe not at therapeutic level that you would want
Mm-hmm.
it. It's more found in baseline level that, like, generally speaking, you want, but just not that like higher level that you need to achieve to get relief of some of these symptoms.
Mm-hmm. Another question was about yoga. So can yoga actually help with PMS?
Yeah, so I find yoga is great because it's an activity, so it's keeping people like moving their bodies, it's exercise. It's also really good to like focus on mindfulness and deep breathing. So yes, yoga can be a really good therapy. Did they do research on yoga versus PMS? I'm not sure. I haven't really looked into the research of that. I'm not sure if there is a study on it, but it doesn't mean it won't be beneficial, because we know that there's a lot of mindfulness practices that come with yoga. And again, you're just moving
Mm-hmm.
your body, which helps with like your endorphins and your feel good hormones, which is great.
Yeah. Mm-hmm. And let me see. I hope I didn't miss. Yeah, how to manage period pain in public? That was one of the
Yeah.
questions.
Yeah, that's a tricky one for sure. Because, when you're home, you can have a heat pack on and you can just curl up on
Yeah.
the couch and do nothing. But when you're in public, I would say that the best thing is, I don't know if you've ever seen those, you can buy like the wearable like heat packs that you can actually wear like underneath like your clothes and no one
Yeah, yeah.
there. So you can have something like that, or just make sure that you start early with your therapeutics, meaning that as soon as period cramps start, that's when I usually recommend that someone tries something to help get rid of them. Don't wait until it's already very severe, because if you wait like 5 hours and you're in the worst pain ever and you're about to go out, by the time you take something, it's not going to have the time to kick in. So
Mm-hmm.
the earlier you can start the intervention, the better it is to keep them under control.
Mm-hmm. Okay. And yeah, I think one of the last questions in the DM was how to manage mood swings.
Yeah, mood swings. Mood swings are hard for sure, because sometimes it could be like stronger than what you like meant to have, right? And again, it comes down to like those like eating enough carbs during that time of the cycle, making sure that like you are on the right like therapies like the calcium or the Vitex, and potentially even doing some counseling or CBT, so that you're able to support your mood swings, have managing strategies for that.
Mm-hmm. So again, the last question, I mean, these were the questions that I had got in the DM. So I just want to tell people that we will have this video on the feed as well. So you can revisit. And if you have any questions, you can either DM me or contact her directly. And then just ending this conversation by, your advice for women who might be, going through PMS, and, what they should look out for if they were to, in that situation of being, diagnosed with PMDD and so on.
Yeah, so my best piece of advice is talk to your medical practitioner or healthcare practitioner whenever you feel like something is more than just like the norm, because again, we normalize PMS so much that we don't know anymore, like, is this normal or is it not normal? And it's definitely worthwhile having a conversation if you're noticing that it's impacting your life, because you shouldn't have to like put your life on pause for a week every single time right before your period. Like, you should be able to just like continue with life and enjoy life throughout the whole cycle. So if you're noticing that you're kind of putting a lot of things on pause that time of the cycle, it's not normal. You should definitely talk to someone.
So just one last thing which came to my mind was, in your experience, in your practice, the women who approach you, first of all, just to normalize the PMS and PMDD conversation, how many of them have been successfully been able to actually, manage their symptoms and get treated?
Yeah, a lot of them. A lot of them have been able to. And sometimes it's not just like through the therapies that we use, but it's also just through like letting them know that this is either normal and abnormal and these are strategies around it. And now they know that they're not crazy and they're not making it up. It's actually
Yeah.
like a more severe form of PMS. And so just like having that conversation definitely helps them feel at ease that like they weren't making it up and it was more extreme than what the norm is.
So yeah, thank you so much for joining me. These were all the questions, and it was a great conversation. I learned so much from you, and of course, like, I'm pretty sure it's going to help a lot of people. Thank you so much.
Thanks for having me.
Yeah, thank you.
Well, this brings me to the end of this video. Thank you for watching. If you liked the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram.